Welcome back, everybody. We told you about the governor of Ohio just testing positive for the coronavirus. We're watching that. Things will still look good. It's not advanced, obviously. What worries folks when this really begins to escalate, if it gets into the respiratory system or it compromises anything having to do with just basic breathing, then you've got some problems, and then the prospects turn a lot dicier. Enter my next guest, who's trying to address that with some potentially very, very promising treatment that cuts that at the pass and reverses the same type of respiratory anomalies that are generally its most dangerous signs. Dr. Raghuram Selvaraju joins us right now, the Relief Therapeutics Holdings chairman. Doctor, good to have you. Thank you for taking the time.
Thank you for having me.
Can you explain how this works and how it might help, particularly for those for whom the respiratory issues become acute?
So our drug, which is known by the generic name of Aviptadil, our trade name for it is RLF-100, is effectively a peptide which is endogenously produced by the body. So it was originally discovered back in the 70s. The scientific name for it is vasoactive intestinal peptide, or VIP, and it has a number of functions. It modulates immune system function. It works to dampen inflammation that gets out of control. So when we originally started this project, which is now in phase 3 development, we were surmising that it would quieten down the out-of-control inflammation that occurs in the lungs of people who are infected with COVID-19, who manifest these respiratory problems, acute respiratory distress syndrome. We have recently also seen that this drug actually appears to have the ability to block the SARS-CoV-2 virus from entering specific cells in the lung, the type 2 alveolar cells, which are very important in mediating lung function, in producing what's called surfactant, which is important for keeping the interior linings of the lungs working properly and mediating effective oxygen transfer. So we actually seem to have here a drug that could work in multiple ways to address the respiratory problems that COVID-19 can manage.
So if you can arrest the respiratory issues, doctor, obviously that negates the need for ventilators and the other stuff. That normally when it's advanced to that stage, things get dicey. Does this take the dicey out of it then?
Well, that's clearly our hope. It's early days, but we are seeing very promising results in patients who would normally have been considered, very much at late stages of respiratory compromise, who were on ventilators but not doing well. And it appears that in the cases, the drug may have turned things around for them. We're also, as you may have seen, working on an inhaled formulation of the drug. So what we're currently testing is an intravenously administered form, but we're also working on an inhaled form we hope to have in clinical development very soon, which will be applicable to even earlier stage patients with the disease.
All right, doctor, thank you very much. Very, very promising.